delivery at the Maryland Healthcare Commission. MHCC is an independent regulatory agency whose mission is to support innovations in care delivery that focus on improving health outcomes and quality of care while reducing costs to the healthcare system. This includes diffusing the use of health IT statewide and increasing awareness of cybersecurity best practices to reduce cyber risk. During today's webinar, you will learn some steps you can take to improve your cybersecurity and reduce the risk of a breach. We will also highlight some cybersecurity resources. Before we get started, I would like to cover a few housekeeping items. This webinar is being recorded and will be posted to MHCC's website. A copy of the slides will be emailed to all participants. In the event that this webinar is breached, we ask everyone to please hang up immediately. I'll send a new meeting link via email to everyone who registered for the event, with instructions for how to join the new meeting. Continuing medical education credit will be offered for this webinar. Please include your name in the chat box window to confirm and record your attendance. For those joining us over the phone, please send an email to confirm your attendance for today's meeting. I'll provide more information on how to get your CME credit at the end of the webinar. At this time, all webinar participants are muted to limit any background noise during the presentations. We will have a 10-minute question and answer session following the presentations. To ask a question, please raise your hand using the hand icon at the bottom of the screen if you're joining us online. There will be an opportunity for questions from people joining us by phone. You may also include questions during the presentation within the chat box window, and my colleague Melanie will read these out loud to presenters at the time of the Q&A session. You can unmute and mute yourself using the small button at the bottom of the screen that looks like a microphone, or by entering *6 if you're joining by phone. Please keep your line muted until you're ready to speak to avoid any unintentional background noise. MHCC staff may mute you if there's a lot of background noise coming through. If you're having issues with your technology, please email, call, or text Justine Springer. Her contact information was included in the email sent yesterday and will be available in the chat box. I'll begin the presentation with an overview of cybersecurity. Cybersecurity in healthcare involves electronic information and assets from unauthorized cybersecurity in healthcare, involves protecting electronic information and assets from unauthorized access, use, and disclosure. The healthcare industry has traditionally lagged behind in data security compared to other sectors such as banking and retail. Healthcare organizations are vulnerable to attacks due to a variety of endpoints and increased dependence on various electronic systems to manage patient billing records and perform administrative functions and manage patient medical records. Cyber criminals usually exploit these vulnerabilities, for example, through phishing, which is a fraudulent attempt to obtain sensitive information such as passwords and usernames, generally via email. Phishing emails typically appear to come from a legitimate source, and that makes it harder to detect. Ransomware, the most common type of malicious software today, is often instigated by a phishing email and is the leading cause of hacking and IT breaches today. Awareness and implementation of cybersecurity best practices is key to reducing cybersecurity risk. Some practical things that you can implement easily to safeguard health information, even if you don't have a dedicated IT staff, include regularly backing up all data, properly logging in and out of computers, and creating an incident response plan. Conducting a risk assessment is also important to manage risk. I'll share an MHCC resource to help you get started, and our presenters will provide more information. The MHCC Cybersecurity Self-Assessment Readiness Tool helps you assess readiness and potential gaps in cybersecurity. A series of self-evaluation statements are grouped by people, processes, policies, and technology, which align with the NIST cybersecurity framework. The NIST cybersecurity framework integrates industry standards and best practices to help organizations manage their cybersecurity risk. The third link is from the Office of the National Coordinator for Health IT, and it provides information and resources for reducing cyber risk. The cybersecurity practice link offers best practices to improve awareness and enhance security posture. And lastly, for more information on cybersecurity, including an assessment of breach trends and resources, you can go to the linked MHCC cybersecurity webpage. So this webinar is intended for informational purposes only. Information provided by presenters regarding any specific product or service does not constitute or imply MHCC's endorsement or recommendation of such product or services. So now I'll turn over to Dr. Seidel, who will share his practice cybersecurity concerns and the strategies he's implemented to address them. Thank you for joining us, Dr. Seidel.
Thank you for having me. My name is Jay Seidel. I have practiced in the Baltimore area. I'm a graduate of Temple University School of Podiatry, and I did my surgical residency in Harrisburg, Pennsylvania. I practiced in Baltimore since 2014. Next slide, please. Three main topics that we're going to discuss in my part of this lecture is identifying areas of potential threats, implementing prevention, as well as some security improvement pearls that I've implemented in my practice. Next slide, please. Employee access is a very easy access point to control. Every employee should have exactly what they need in order to fulfill their responsibilities in the practice and no more. Having strict guidelines and rules, as well as access control for employees, will very much decrease the chances of attacks. Next slide, please. One of the most common issues are areas of access where people outside of the practice can gain access is through malware phishing attempts. Clicking on a rogue email link or opening up an email or a file that is not something that should be opened, and staff should be made aware that all links should only be opened if they are from a known source. Next slide, please. Vendors, healthcare vendors that we work with, whether it's through equipment or other suppliers, should maintain the same security requirements as our practices. A business associate agreement is a written arrangement that can specify what each party's responsibilities are when it comes to patient health information. Next slide, please. Online medical and mobile devices. Today, in this day and age, in an Internet of Things, many of our devices, including medical devices in the practice and mobile devices that we carry around with us, are all online almost all of the time, ensuring that these devices have proper protocols in place and security software on them will decrease the chances of hackers gaining access. Next slide, please. And then inadequate disposal of old hardware. So not only is there concern with items that are devices that are attached to the internet, but anything that is saved on the devices, whether on the hard drives or in the memory cache, needs to be disposed of properly when it's upgraded or when it's disposed of. So destroying those devices or ensuring that all patient information has been completely removed is imperative to contain potential threats. Next slide, please. So once we've identified these potential areas, we need to make sure that all practices and protocols are in place in order to decrease risk. It's very important to keep in mind that not only are these risks very detrimental to patient information and to patients themselves, but there's also financial and potential jail time for violation of these infractions. So on to prevention, understanding your network maps. So knowing exactly which devices you have on which networks and who has access to those networks is super important to determine if there are any unauthorized users accessing any of your equipment or any of your infrastructure. Next slide, please. Updating your software. So many times we utilize vendors to provide equipment and software for our practices. Our part is maintaining those devices as best we can. Updating our software will ensure that we have the most up-to-date security protocols in place, and any breaches that have been found will usually be corrected by updates in software. Next slide, please. Virtual private network encryption. This usually involves a specialized IT component of your practice. It's a little bit more advanced, but basically it ensures that your practice is its own bubble and has its own private network, which then is connected to the internet. So it's an extra level of protection for those, especially if they have a lot of devices connected to the internet and are concerned with security. Next slide, please. Audits. So not only do we need to do internal audits for our taxes and for our finances, but it's also important to do that for our security. Making sure that every device is up to date, making sure that there are firewalls in place, making sure that each patient has the private access that they need for their patient portals, and making sure that each staff member has the proper access to do their job properly. Another component is the security risk assessment, which is actually part of the MIPS program, which Medicare can give bonuses or punitive, deductions to payments. And conducting a security risk assessment is actually part of the MIPS requirements and can help you earn a bonus and or prevent a penalty. Next slide, please. Strict access we discussed is making sure that each of our staff members has exactly the access that they need. They should be able to access the patient's charts when they need. They should be able to access the patient's records and reports. And Facebook or Instagram may not be a direct requirement for that patient from staff member's job, and therefore should the email, even private email, also should be restricted for when they're treating patients or taking care of patients. And that really reduces the possibility of staff misuse. Next slide, please. So these are some of the things that I've implemented in my practice. There are different options for electronic medical records, for billing and scheduling. We've elected to go with a cloud-based system because we found that, first of all, it shifts most of the responsibility of maintaining a server and maintaining access and software to the provider. Instead of having an in-office server that you need to maintain and you need to secure, you're really shifting a lot of that responsibility. Obviously, it's still shared, but you're shifting that responsibility to the vendor. It also can save you some money on hardware. You have a computer that has access to the internet, and that allows you to access your cloud-based system, as opposed to, again, maintaining a server, maintaining an IT specialist to run that server. The other benefit is that you can access this patient information anywhere with an internet connection. So if you're taking call from home or if you're doing telehealth, you really do have access to that cloud-based system, whereas in your office, that would be up to you setting up a server that has internet access and from outside of the practice. Next slide, please. The right hardware can also be used to help provide security. We use Chromebooks in our practice, which have built-in security from the ground up, including sandboxing, in which each tab is a separate component, and therefore viruses or malicious attacks cannot extend from one tab to the other. Verified boot makes sure that every time you turn it on, it's the correct computer and there's nothing that's been modified by someone outside. And updates are also built in, which facilitate having the most up-to-date software and security protocols in place. Regarding credit card processing, I'm sure many people take credit cards in their office to help facilitate patient payments. Being up to date and making sure you have the proper payment card industry compliance reporting, that's an update on their end, as well as on your end to make sure you have the hardware that can ensure EMV chip reading, as well as now everybody's doing touchless and tap reading. It greatly protects the patients and their credit card numbers, as well as protects you from chargebacks and disputes because it ensures that the actual owner of the credit card was using it. Another option for many online portals that we access and software that we use is two-step verification, which ensures that you are the one that is actually accessing the software via text message, or if there's a GPS tagger, or if there's an authenticator app on your phone. it ensures that there's no other outside access. Next slide, please. That's it for me. Does anyone have any questions? Thank you very much for your time.
Thank you, Dr. Seidel. So Anena is having trouble connecting, so I'm going to kind of step in, and Justine can keep showing the slides and presenting. So special thank you to Dr. Seidel. Our next presenters are Terry Kinsman and Tom Conkle, who will discuss key cybersecurity considerations and identify user responsibilities within the software as a service, or the SaaS model. So thank you both for joining us, and I'll turn it over to Terry. Terry, you're on mute.
There we go. Good afternoon. I'm Terry Kinsman, the founder and CEO of Coldfish Compliance, headquartered in Bethesda. I'm a native Marylander, a U.S. Navy veteran, and compliance and test engineer in the intelligence and IT cyber communities. Coldfish is committed to serving Maryland small businesses located in the Washington, Baltimore area and remotely in the areas of healthcare, financial services, and U.S. government sector support. Next, please. So today I'm going to talk a little bit about how to lay the foundation for a strong cybersecurity plan. And we'll also look at the current top attack vectors for small practices like yours. I have about 20 minutes to cover a lot of ground, so we're going to go fast, and you can keep your questions or note them at the end, and we'll be able to get to them. So if you search HIPAA compliance or cybersecurity for medical practices, you'll see thousands of possible solutions and as many directions to go. It's a common overwhelm and leading cause of failure when making cybersecurity decisions. So how do you get started in the right direction? Next, please. By having a strategy. Having a strategy is critical for an effective, cost-efficient, and compliant security plan. A security plan is the actual required, legally required written policies and procedures that describe how you protect the CIA, and that stands for confidentiality, integrity, and availability of your patient's protected health information. A strategy is going to be how you implement your security plan. So a solid strategy includes knowing where you are, where you need to be, and how you're going to get there. So unlike unregulated businesses, protecting your patient data is not an option for healthcare providers. It's a legal requirement. So the first step in creating a strategy is knowing the laws and regulations applicable to your practice. Typically, small healthcare providers are required at a minimum to comply with the 5 main HIPAA rules, PCI DSS, and state data privacy laws. Next, please. In order to establish where you are and where you need to be, you need a comprehensive assessment of your data security environment. You do this with a risk assessment. A risk assessment helps define your cybersecurity risk posture by using an organized set of questions, sometimes a lot of questions, based on the specs applicable to your business, so that you can make informed decisions about next steps to take. Why would you use a risk assessment to do this? Primarily because it's the law. It is a HIPAA requirement, and it's built into the state privacy laws as well. A risk assessment is going to formally document your cyber position, and that's going to establish a critical paper trail, inform you of your highest risk areas and the gaps in between where you are and where you need to be. Sometimes that's why it's sometimes called a gap analysis. So how do you perform a risk assessment? You can do it yourself. We've included a link to an OCR security risk assessment tool that was built for small healthcare providers, and it's very good. It's very intuitive and easy to use. Or you can use a vendor who's familiar with your business and regulatory requirements. The results of a risk assessment are going to help you plan your strategy and make decisions about how to allocate resources to best protect your practice. Next. Here's a sample page from the summary report of that do-it-yourself security risk assessment tool I just mentioned. So based on your answer, this slide, by the way, has 3 clicks, please. So just forward it 3 times. 1, 2, 3, 1, 2, 1 more. 1 more. There we go. So this is just a sample from that risk assessment tool I mentioned in the summary report, the end of it that you would get. So based on your answer to question 5, it was determined that you have several critical risk areas associated with not having cybersecurity documentation in place. With this information, you can decide whether to mitigate the risk by implementing a solution, or you can accept the risk and do nothing, which may be okay in some situations. Not all summary reports are like this one, but they will all typically inform you of where you are and where you need to be, which is foundational to a durable and effective cyber defense. So to review, a security plan is the actual required written policies and procedures that describe how you're going to protect that CIA, that confidentiality, integrity, and availability of your patient's protected health information. A strategy is the steps you're going to take to implement your plan. You might also hear that called a POAM, P-O-A-M, or a plan of action milestone, or a gap analysis. So let's change gears here for the last few minutes and look at the top attack vectors for small healthcare providers in order of their frequency of occurrence and the cost. Next slide, please. The #1 attack vector in terms of frequency and cost solidly remains unintentional human error. You can have the most expensive IT infrastructure in place, and without trained users and a documented security plan, your vulnerability to attack is wide open. The strongest response to this attack vector is user training. If you do not have a training program in place, we've included a couple of links to online support to get you started. If your security plan is undocumented, I encourage you to look into getting started with that as well. A common statement included in OCR penalty judgments is the following. It says, ignorance of HIPAA compliance requirements is not considered justifiable defense against fines and sanctions. And this means just what it sounds like, that ignorance of HIPAA compliance requirements is, and we're talking data security requirements, is not considered justifiable defense against fines and sanctions. And in a few slides, I'm going to show you how serious the OCR is about that. Next slide, please. Email. I could, like Dr. Slater was saying, I could talk forever about email and share very clever tricks that are out there right now. But for this presentation, please know that it remains a brutally weak link for most small businesses. 91% of cyber attacks start with a phishing email simply because it works. Email doesn't rely on exploiting vulnerabilities. Vulnerabilities are like system flaws, programming errors, configuration issues, and the like. Instead, it uses simple deception, sometimes clever, but still deception, to lure you into opening attachments, disclosing your credentials, or taking actions that bypass your normal policies and procedures. What can you do about this right now? Provide training so your users can not only prevent email attacks, but know what to do if they think they've made a mistake. That's super important. And ensure your sanctions policy lets your users know that you are serious about data security and that careless email hygiene is unacceptable. And don't shy away from the sanctions policy. It's a HIPAA requirement to have one. And I have found after thousands of hours of user training, people do better when they know better. People do better when they know what's expected of them. You can also use your risk assessment summary report to identify devices that can receive, transmit, or store your PHI, excuse me, and harden these devices. And what I mean by harden them is Use software, SaaS, that stands for Security as a Software as a Service. Tom's going to talk about that in detail after me. Virtual private networks, firewalls, antivirus software, email filters, and take advantage of your web browser and email client anti-phishing features. These can be very strong. Next, please. Passwords. Password security is one of the first cyber warnings we learn, yet it remains a dangerously vulnerable point of attack. In 2021, we are so interconnected by our devices at home, work, school, and everywhere in between. This level of access creates a drastically increased risk of cyber incidents because of how we connect and the data we access. Enforcing good password hygiene and protecting your physical credentials like badges, access cards, and keys is so important and relatively easy to do. If you're just getting started with written policy in general, start with a password policy and make sure you include those sanctions so people know what the consequences are for disregarding an important policy. Change your passwords. This is old school, but it's very important and very effective. And I mean really change them, not just one letter off or change caps or something like that. The next thing you can do now is prohibit group IDs and passwords. This is a common weakness in small practice because there's typically one computer in the reception area or something where multiple people, shifts, users have access to this computer. And if you don't have unique user ID and password for the data that these people are entitled to use, you have no way of tracking who's been on your computer and what data that they have accessed. Use two-factor authentication wherever possible. I can't think of an application or a device today that doesn't have it available. You can just search on the device or search online. We don't have time to go into all of that today, but use two-factor. It's very strong, multi-factor. Complex passwords are also great. People use password lockers. If you do that, or password generators, if you do choose to use that for your practice, I encourage you to use one that costs, not the free ones, but ones that maybe cost a couple of dollars a month. They're much more robust and handy. But remember, nothing's 100% when it comes to the password lockers. And the next one is so important. Never use the same business, personal, and home passwords. If one of those areas have a weakness, then all of them do and have that same level of weakness. Remember, the bad guys have nothing but time and math on their side. So be very careful about using similar or the same passwords between your home, your business, and personal devices. And of course, training. Next, please. The fourth attack vector we're talking about is controlling devices that have access to your PHI. And this would seem simple. It would seem like it would go with the other ones, but it's a different beast because devices that access your PHI are uniquely vulnerable in many ways because they're often mobile or easily accessible. It's very important to know the who, what, where, and why of all devices at all times, including your assets like printers, fax machines, and IoT devices, even if they don't directly access PHI. The best thing that you can do to defend against this attack vector is to have a solid asset management and change management process in place so that you know the status of your devices at all times, and include what's acceptable use of your devices that access your company information with strict sanctions in your security plan and user training. This table shows a few of the fines in 2020 for small healthcare providers. I pulled some small practices so you may relate. These fines are serious and reflect the OCR's willingness to pursue noncompliance for all size providers. This was the one, two, third one down, unencrypted stolen laptop, $1 million fine. Rights of access, that's patient data, patient asking for their data, and you can't produce it. Failing to implement. These fines are serious. Next slide, please. The last attack vector we have time for today, it concerns vendor support. Vendor relationships are fast approaching the '1 attack vector for all of industry due to the popularity of SaaS and outsourcing expensive staff like accounting, IT, HR. If your vendor doesn't have proper cybersecurity in place, your data and possibly your business is at risk. In the event of a cyber incident, it is very, very important to prove you understood and accepted your vendor's cybersecurity position. This is done with a business associate agreement or a BAA. Common mistakes of small healthcare providers include assuming your business is too small or your data has little value. Healthcare data is loaded with ancillary data and very valuable. Small business healthcare providers are low-hanging fruit and dark web darlings, really. They tend to use another mistake is small providers tend to use what I call legacy technical support. People who have been helping you for years or help that may be great with your computers, but unaware of your regulatory requirements. It's also important that you are aware of the criticality of each vendor service. If they were to fail, how would that affect your ability to practice? How would that affect the CIA of your PHI, confidentiality, integrity, and availability? The law says you'll have a BAA that details all data security expectations for both sides of your vendor relationships, and you're going to review it routinely or as changes may happen. You must also document how you monitor and control your vendor support. This means formally touching base on a regular basis, or at least annually, with all your vendors. That practically speaking may look like an updated BAA, a document change control page that you've looked at least annually. Next, please. I wanted to do a quick mention for the Buy Maryland Cybersecurity Tax Credit Program. Governor Hogan recognizes the value of Maryland small business to our economy and their vulnerability to cyber attacks. Small businesses typically do not have the staff or budgets of larger companies and are particularly vulnerable to catastrophic loss due to cyber incidents. This program gives a 50% tax credit for everything we've talked about today and more. The website's straightforward, and both Tom and I are qualified sellers and can answer any questions you have. Next, please. This is my company mascot. His name is Riskers, but I have a minute, so I wanted to address cyber insurance because I get a lot of questions about insurance. Yes, it's available, but like all insurance, the issuer will require evidence that you're a good risk. This proof is your written security plan. There's no getting around it. Cyber insurance is not a substitute for having a security plan. But this is an important thing to know about cyber insurance is just a click off of other insurances like your homeowners or auto insurance, in that you would get your car back or your home fixed. In the event of a cyber incident, insurance may help bear the financial burden, but once your patient's protected health information is out there, it's gone. You don't get it back. So I encourage you to take a look at your security plan strategy, perform a risk assessment to know where you are, where you need to be, and how you're going to get there. This knowledge will help prevent you from taking the bait of tempting quick fixes like Mr. Riskers here. If you need help, please ensure you use a reputable provider familiar with your business and regulatory requirements, and never share your PHI or business details without a written BAA in place. Small healthcare providers are literally hunted. So don't share your business details either. They're as valuable as your PHI. Cybersecurity and HIPAA is not easy, but it is scalable for small practices, and there's plenty of qualified help available. Thank you for taking the time today to invest in the security of your business. Please feel free to contact me with your ideas or questions. I'm here to help. Thank you.
Tom, you can go ahead.
Okay. Yeah, do you want to go to the next slide? Okay, so hello everybody, thanks for joining today. My name is Tom Conkle from Optic Cyber Solutions. Optic Cyber Solutions is a cybersecurity consulting company here in Maryland. We help organizations do cybersecurity risk assessments so that we understand the risks of their organization, as well as helping them implement strategies to address those risks that align to their business, right? We understand that most of you aren't in business for the security of the system, right? You have a day job that you need to do, and that's what we try to do, is help you make sure that you can do it efficiently as well as securely with that. So today, I want to walk through a couple of the examples and put some of those strategies that we've talked about earlier today. We heard Dr. Siegel and Terry talk about needing to have a good cyber strategy in place. Some of the threats that are available, that are out there trying to harm us. We've heard that there's a lot of compliance requirements we need to meet. I want to take a moment to talk a little bit of a practical way that we can put all of those practices in place. So specifically regarding software as a service. So if we go to the next slide, see, software as a service is a service model that most of us use today, right? Rather than having data centers in each of the clinics, right, we use services and capabilities that are typically in the cloud, whether it's Gmail for email, Dropbox for storing files, or there's plenty of EHR systems out there where we aren't responsible for running the software and maintaining where those health records are stored, but the service provider gives us access to it, right? So when we talk about software as a service, it's those kind of environments where you're buying or typically paying a subscription to use their services or capability, and they're maintaining the data for you and then giving you access to that. So a lot of organizations just assume that, well, if I am using a SaaS provider and they're providing, they have the data from my clinic, they have my patient records, and they're just letting me access it when necessary, they're responsible for all of the security aspects of it, right? And as Terry mentioned, right, we know there's a lot of penalties that come with not following HIPAA guidelines, right? But it doesn't necessarily mean that we can transfer all of that responsibility to them. So on the next slide, we can talk about what are the supplier's responsibility, right? Here we can see that they are responsible for protecting that data at rest, so that when you do give them, if we are talking about a health record management system, right, and we're giving them our patient data, right, they are able to, or required to protect that data at rest, right? So when they're storing it in their file systems, we know that it's protected typically through encryption. They typically provide transport mechanisms for us, so that whether it's through a browser and an HTTPS connection, so that we know that the connection's encrypted, they will help us manage that kind of communication tunnel so that the data can be sent securely. Right? They will also make sure that the data remains segregated from other patient data as well as other customers that they may have, right? So that we can have some assurances in place that our data is not being intermingled, and then backups, of course. Most of the service plans that we have with these types of organizations, if we need access to the data, they will, we accidentally lose a file or something, they'll recover it for us and provide that backup. So that there are a couple things that, that the suppliers can help with, and we can give that responsibility for. But the trade-off, what we need to do is just as important. Did want to make a quick note that what we're talking about now today, there's plenty of other guidance out there, and what a supplier's responsibilities will be, as well as you as a consumer, that we'll go through in a moment. So we're just going to touch the highlights today for that, but there are plenty of other guides, documents, and organizations that can help you narrow through it. The NIST Special Publication 800-161 you see there, it defines cybersecurity controls that you should consider when putting or when enacting with a SaaS provider, such as the ones that we're talking about today. So I just wanted to kind of stay that we'll stay high level and just kind of practical today for it, so that we can understand that relationship between the consumer and the supplier. So if these are the supplier's responsibilities for protecting the data at rest and helping make sure that we transfer the data, what are your responsibilities, right? We've given it to us. So on the next slide, we can see that you still have responsibility for protection of that data too, that there's just some things that you can't transfer over to them. In many cases, the supplier will set up an account for you. That's what you're paying that subscription for, but you get to manage the access to that, right? So who within your staff are able to access it? As Terry talked about earlier, in authentication and making sure that you set up the authentication so that users have strong passwords, right? That they're using that multi-factor authentication and that they're not sharing accounts. These are all kinds of responsibilities that would fall back on you as the individual or the clinic that's accessing the supplier's data, right? As well as training your users, right? Making sure that they understand the expectations for whether it's privacy or the security of that data, how they can have the data, where are they allowed to access the data from the supplier standpoint, as well as the physical protection. So obviously, something simple as a patient record, right? If we're going to print that locally at the clinic, there's no expectation that the supplier will be able to protect it at that point, right? So there's physical protections of the access points that are accessing the supplier's network, as well as the data itself that we might bring into the clinic that we're taking from the supplier, right, are things that are our responsibility. So we've talked about the fact that we know that now that they have responsibilities while they provide that product to us, we have responsibilities on our side. But how do we put it all together? And one of the things that was mentioned previously is doing a risk assessment or understanding the compliance requirements and understanding your risks so that you know, right, how am I going to set up access control? How am I going to handle account management? Who can I give accounts to and still manage my risk in the organization? Or we can look at it as another approach of saying, well, I know I have these compliance requirements. How am I going to make sure that I meet compliance requirements? So if we go to the next slide, you'll see here is just an excerpt of the HIPAA security rule. And it tells us that, we all are familiar with HIPAA. We understand all of the protections and requirements that we know that we need to implement. We know that we have responsibilities for protecting our patients' information and so forth, right? And it establishes the safeguards that are required from a confidentiality, integrity, and availability standpoint. However, HIPAA doesn't actually tell us what we need to do specifically, right? HIPAA, as a law, is written generally for all size organizations, whether size, the complexity of the organization, or regardless of the type of care that they're providing or the services that they're providing, right? It has to be able to fit everybody. So it leaves us, which is great because it leaves us a lot of leeway and allows us to implement controls that make sense to us, right? Instead of being very prescriptive on how you will handle account management, how you issue accounts, and so forth. So, but to understand what is appropriate for you, right, in your organization, we can actually break down HIPAA a little bit further. On the next slide, you'll see here an excerpt of some of the HIPAA requirements. And what we've simply done here is said, okay, we understand that we have these HIPAA rules. In here, for example, we see 164.310A1, right? This is all about physical access, and making sure that we are physically protecting electronic information systems within our facilities, right? So we know this is the security rule that's out there. Fortunately, HHS has already kind of taken apart HIPAA for us to build out the security rules and told us what each of those are. And we have a link to that resource at the end of this presentation so that you can see discreetly what are all of the security controls that we implement. So when we're dealing with a SaaS environment, we know now what we need to do, and then we can actually walk through and say, how are we going to do it? So on the next slide, we'll see here that we can simply fill out the matrix, right? Continue the matrix that are available to us to say, here's the supplier's responsibility, right? They're going to have the data in their data center. And all of the data center protections, physical protections, whether that's a fence, a guard for the facility, those things, right, the supplier is responsible for. However, you still have responsibilities in your clinic. Oh, go back from one to the consumer side. Thank you. From the consumer side, right, you understand that you still have to protect the devices that are accessing that data center, so that once you, pull up a record locally at one of your workstations, then that device needs to be protected and make sure that it's unaccessed. So by going through this kind of a matrix, as we see here on the screen, you're able to say, understand what's the supplier's responsibilities. Here we can say that you as the consumer are responsible for providing physical protection to workstations that access the software as a service solution. And then from that, we can step back and say, all right, well, let's look at our clinic and say, what are we doing with workstations? Are we meeting this, our portion of the objective to address this control? And in this case, we may identify a gap such as, the workstation being left unattended and logged in during working hours, right? So if we have that workstation in the reception area and the receptionist needs to go take care of a patient or something, right? They may walk away from that terminal, leaving it unprotected, right? So that would be a gap in our security program as it aligns to this compliance requirement. And then on the next slide, we can see here how we can just continue building out this matrix to understand. Again, that we have the backup requirements here is another requirement from HIPAA, make sure that it's protected. So here we say, well, the supplier is going to back up all of our data, right? Make sure that we have the ability to restore it if necessary. And we may put a policy in place as a consumer that says, we're not going to download any of that data. We're not going to copy any of that data locally, because we know that they're going to do the backups in the SaaS solution for us. And as long as we make sure that we put the data there, it'll be covered, right? So in this case, we may say, we have this policy in place, we're covered on that. And then as a third example, on the next slide, you'll see here is just for security awareness training, right? So we may understand that, as a SaaS provider, right, they're responsible for training their staff, right, on the administration, the maintenance, the operations of the servers that they maintain, and make sure that they're done securely, right? How they handle the subscriptions of new accounts, and so forth. That's their training responsibility. But then we know we have responsibility to train our staff, right, on how they're accessing those records, to know that they can't walk away from that workstation that we talked about earlier, and those kinds of things. But this matrix gives us an ability to capture, like, maybe we don't have a good security, a security awareness training program in place today. So we can just drop that down and say, okay, well, this is what we're not doing, right? We don't, we have a security training program, but as you see on the slide here, right, we don't provide any training about not sharing your password, right, or not putting your password on a sticky note in the office. So again, this is just an example of how you can take, what seems like a lot of scary things that are out there, from the threats, the people that are trying to attack us, from the compliance people that are trying to come, and make sure the data is secure, but levying fines to make sure that we file, and break down all those requirements into a simple matrix that makes it more manageable for you. And you can have, just a simple conversation with your staff or with yourself even, and say, all right, what am I responsible for? And this example here is specifically just understanding the difference of the SaaS environment, and say, you may not really be responsible for everything, but you need to understand what are they doing so that you can make sure that you're doing your protections appropriately as well. Okay, so on the next slide then, so if we understand that, where can we go from here? As I mentioned, HHS, and there are many others, even we have some references to the Optic website, where there are other breakdowns of cybersecurity expectations and requirements that help an organization understand, what they need to do. But establishing a simple matrix like we just saw is a great way to get started, just to have that understanding of what your current capabilities are, what protections you have in place, and making sure that it's documented so that we have the ability to go back and refer to it and explain whenever someone does show up and say, how are you doing, or how are you addressing these security requirements? Well, now we have it all in one simple place. It may reference policies or training material, but at least we have that summary, if you will, in one place. It makes it easier to reference and making sure that we're doing things the right way. As you're filling out those matrices, a lot of times, right, You can work with your SaaS provider. They'll tell you the services that they provide, what their expectations are. Sometimes they tell you in the form of service level agreements when you sign up for the subscription, right? They'll give you the terms and conditions of what they're going to provide. Other times they'll have a help desk and you just can call them and say, hey, how are you implementing these kinds of capabilities to make sure that it's in place? There are resources that you probably have access to today that'll help you in filling out and understanding, what, at least from the supplier side, what they think they're providing and going to be able to help you with from that point of view. And then, of course, just knowing that we have to have the BAAs and understanding the connections and who we're sharing our data with might give us the ability to understand, well, what type of matrices do we have, right? How many SaaS providers do we have? Or maybe we have outsourced some of the capabilities elsewhere, right? The same kind of a matrix example would work in those as well. So it's a way for us to make sure that we understand where they are. And it's also a way to go back and say, oh, we do have this SaaS solution. They are having data. Do we have that BAA in place? Making sure it's protected from that standpoint as well. So again, my name is Tom Compo. I appreciate you taking the time. I know we went through that pretty quick. I wanted to provide some examples of tactical things that we could do to just help get our arms around all of the strategies that we've talked about today. I'd be happy to answer any questions today, or my contact information is on the next slide, and feel free to reach out if you have questions there as well.
Thank you very much, Tom and Terry and Dr. Seidel, for your presentations. We will now open it up for questions and answers. As a reminder, please raise your hand using the hand icon to be recognized, or enter your questions into the chat box. So we'll also give the folks on the phone a minute to unmute if you have a question. And again, to unmute, it's *6 for those over the phone. All right, so we have a question for Tom while we wait for people to unmute themselves. So Tom, how do I know if my SaaS provider is meeting their obligations?
That's a great question. Unfortunately, because of most of the time for the smaller clinics, it's not like you can show up at the door and say, prove to me that you've implemented these protections. The easiest way, most of the organizations that we work with, is through their service level agreements, and that you have the contractual requirements in place as the expectation is, right? So that we're still able to shift that burden over to them because we've had that capability in place, right? That requirement in place that what their expectation is on the side of the contract for it. And then depending on the type of agency or organization that the SaaS provider is, there are other programs out there that you can go through and say, have they gone through a security assessment? What is their report? How were the findings from the security assessment? And you may even be able to ask them for that to prove, to demonstrate to you that they have gone through a security assessment, a similar capability of your own, to assess it that way. So, basically the easiest way is through the contract, the SLAs, and understanding the expectations and getting them to confirm that they're doing it. Right. If you can't get this, or if you can't do that, then you ask them for a security assessment report to demonstrate that they've tested their capabilities, made sure it's in place. And then HHS and others do work with some of the larger groups to be able to provide those kind of reports out there to say, these people have been tested and evaluated and can handle your data in this way.
Thank you very much, Tom, for that response. Do we have anyone who wanted to ask a question over the phone? Or joining us via video. All right, so we have a few more minutes for another question. So we'll go with a question for Terry. Terry, the question is, what happens if I do nothing?
That's certainly a choice that you can make. And sometimes people do make that choice because it's overwhelming, or the vendors that they work with, they get some pretty scary cost numbers that are hard to budget for on the fly. So if you do nothing, you get nothing, and that used to be okay. A lot of people are like, well, I'm not going to do anything wrong, or if I don't have any complaints or any reportable breaches, then they'll never know. Unfortunately, that's not true, and it's doubly not true now. The CARES Act included a couple of more protections and flexibility for the OCR, that you can now be audited. They can come and knock on your door just because they can do like a random, like they do with the financial industry. They can come and randomly audit your practice to make sure that you are compliant with the laws and rules that are applicable to what you're doing. So you don't have to have a breach or anything like that, or a complaint. So doing nothing is, I guess it's a risk choice you can make, but it's right up there with worse than no seatbelts or other risky behaviors that you could do that could be very costly.
Thank you very much for that response, Terry. We have a minute more for one question. Again, I'm just going to pause to see if anybody wants to chip in and ask a question at this point. All right, hearing none, we will move to closing. Thank you all for attending today's Cybersecurity Lunch and Learn webinar. We hope that you found this information valuable. CME certificates will be emailed to each attendee, and a copy of the webinar slides will also be emailed to everyone. For those joining us by phone, please send me an email to record your attendance. We have a couple of people over the phone, a number ending in 88, 73, and 95. Please send us an email so that we can record your attendance at today's meeting and get you your CME certificate. In the email we sent to you following this webinar, you find a link to a very brief post-webinar questionnaire. We ask that you please take a couple of minutes to complete the questionnaire. Your responses are extremely helpful for us, and they inform our future webinars and learning events. We are also interested in hearing from you regarding topics that would be of interest to you for future Lunch and Learn webinars. Thank you again to everyone. Have a wonderful afternoon. If by chance you think of some more questions you would like to have answered by any of our presenters, please feel free to send me an email, and we will be sure that they get directed to the presenter, and we'll get you a response. Thank you very much, everyone, and have a pleasant afternoon.